Okay, in this short video, we're going to be looking at cranial bones. So let's take a look at the skull from the front. This portion right here is the frontal bone. Where the eyebrow goes is the supra, right? Supra means above, orbit. We know orbit is the eye, supraorbital margin. Okay, that's this entire ridge that's right here, supraorbital margin. Now, this extension of the frontal bone that's right between the eyes, right here, that's going to be the glabella. That's called the glabella. Glabella. Inside the eye, there's this depression called the lacrimal fossa. And this depression right up in here on the lateral part of the eye is where the lacrimal gland is, which is what's going to make your tears. So that lacrimal gland is going to be up here sitting in that lacrimal fossa, and the tears roll in this direction to drain into the nose in here. So again, here's your frontal bone. Here's the supraorbital margin. It could be this, or it could be this, right? Supraorbital margin. Between the eyes, the section of the frontal bone is the glabella. And then here's the lacrimal fossa on the lateral part of the eye orbit, but on the underneath, that smooth surface depression right in there. Lacrimal fossa. The upper lateral orbit would be there, and it would be here as well. When we look at this sagittal section right here, here's the frontal bone, and right here is the frontal sinus. While we're looking at this, it's good to kind of show this. So we breathe air in through the nostrils this way. And then here we have a superior, a middle, and inferior concha. A superior, middle, and inferior concha. These concha are also referred to as turbinates, like a turbine. So we have turbinates, like a turbine. What these are, as you breathe air in, especially in the wintertime, like right now when it's cold, we breathe air in, and this is going to centrifuge and spin the air. It's going to moisten it and warm and moisten the air and remove any dust particles that we may be breathing in and allow it to stick to the mucous membrane. Now, in between those turbinates or concha, we're going to have, let's make this blue, we're going to have an inferior, a middle, and superior meatus. A meatus is like the canals. So there's a superior, middle, and inferior meatus. That's in the blue. Okay, so we'll just make 3 lines here, and over here we'll call them meatus. Superior, middle, and inferior meatus. Now, before, when we talked about the lacrimal gland, right, they're going to make tears, and they're going to roll in this direction, and they're going to come down like this, and the tears spill out right here in that inferior meatus. And when you get tears that run from the eye orbit into the meatus, these turbinates swell. They get inflamed. And that's why when you cry, you're like, right? You can't breathe, your nose gets stuffy. It's due to the swelling of these turbinates because they react to histamine. Histamine makes things swell or get inflamed. It's a histamine reaction. Okay. All right, so remember, here's the frontal bone, here's the temporal bone, here's the parietal bone, here's the occipital bone, maxilla, and mandible. Okay. There's your parietal bones from the posterior. Again, let's review the suture. Lambdoidal suture, sagittal suture, and a little bit of the squamous suture. Squamous suture. For the back, these are your two parietal bones, occipital bone, sagittal suture, lambdoidal suture. From the side, parietal bone, frontal bone, temporal bone, occipital bone, mandible, maxilla. We'll put a Z here for zygomatic. We'll throw a new one in there, zygomatic. When we look at the occiput, we're looking at the occipital bone. Remember, here's the lambdoidal suture. There's a little bump right here, and it stands for the external occipital protuberance. External occipital protuberance, because it protrudes. It's the bump. You can all feel it. It's a little circular bump in the back of your skull. And then we have these lines. There's a superior nuchal line and an inferior nuchal line. Nuchal sounds like neck. Superior nuchal line, inferior nuchal line. These are attachment sites for muscles like the trapezius muscle. The traps are going to attach there. On the skull, right there, that's the EOP. Again, don't abbreviate on exams, write it out. External occipital protuberance, EOP. Then these two lines, superior nuchal line, and then you have your inferior nuchal line. When we take the skull and we flip it upside down, right, we can see the upper teeth right here. We're looking at it from an inferior view. Here's the first time we're seeing condyles, which is a smooth surface. It's like a facet. It's a smooth surface. So these are occipital condyles, and the occipital condyles are going to allow the skull to articulate with the C1 vertebrae known as the atlas. Here's the EOC, and here's the EOP. So this is the external occipital protuberance, but here's that crest, the external occipital crest. The crest is going from the magnum foramen. We'll call that the magnum foramen, or foramen magnum, makes no difference. Right from the magnum foramen to the EOP, connecting those two, that's the external occipital crest. So on the skull, here's the occipital condyles. We'll see condyles again when we go over the femur. Then we have the magnum foramen right here. And going from the magnum foramen to the EOP, that's the external occipital crest. When we look at the skull from the side view, again, here's the frontal bone, parietal bone, here's the temporal bone. They're calling it the squamous portion. I'll be happy if you know temporal bone, but this is the squamous suture for sure. This is the mandible. The mandible is going to articulate with part of the temporal bone right here. This smooth depression is called the mandibular fossa. Okay, the mandibular fossa. This part is the mastoid process, and the thin, sharp tooth-looking structure right there is the styloid process. So there's a mastoid process and a styloid process. The mastoid process is really important because there's muscle that's going to attach right there. It's going to go from the sternum and the clavicle right there. And when the sternum and clavicle have an extension going to the mastoid, we call that muscle the SCM, which stands for the sternocleidomastoid. There's the mastoid portion. It's going to go from the sternum and the clavicle to the mastoid, sternocleidomastoid muscle. And then right here, this is the zygomatic process. The zygomatic process. On the skull, temporal bone, or squamous portion of the temporal bone. Here's your mandibular fossa, mastoid process, styloid process, and zygomatic process. Some call this the zygomatic arch or zygomatic process. They're both interchangeable terms. Zygomatic process, or also acceptable would be the zygomatic arch. When we look inside the skull, this bone right here, that's the sphenoid. Remember the bat bone. This is the temporal bone. And this portion right here, all of this is the petrous portion of the temporal bone. Really important section right here. This portion can be dissected and pulled away. And when it is, we can end up seeing the inner workings of the ear. All the hearing apparatus and balance apparatus sits here. The hearing apparatus and balance apparatus is going to be here. So parts called the cochlea, we'll be able to see there. The cochlear and the semicircular canals. The semicircular canals are going to be sitting here deep in this petrous portion of the temporal bone. The cochlear, which deals with hearing, and the semicircular canals, which deal with balance. Your balance. So here's the petrous portion of the temporal bone, and then the squamous portion of the temporal bone. Again, these are both looking at the temporal bone. Now here's our sphenoid. The purple section is the sphenoid, and there is a lesser wing of the sphenoid. That's this. And then there's a greater wing of the sphenoid, which is this portion here. So there's a greater wing and a lesser wing. And in the sphenoid, there is the Turkish saddle, known as the sella turcica. And this smooth depression right here is called the hypophyseal fossa. That's a P, hypophyseal fossa. And what sits in that hypophyseal fossa? What sits in the hypophyseal fossa? That's Fossa. That's going to be the pituitary gland. And the pituitary gland is known as the hypophysis. And the pituitary has an anterior hypophysis, and it has a posterior portion. The pituitary has an anterior and a posterior portion to it. The anterior portion is called the adenohypophysis, and the posterior portion is called the neurohypophysis. So that's where the hypophyseal fossa, that term, comes from. It's another name for pituitary, hypophysis. It's just there's an anterior pituitary and a posterior pituitary. When you do endocrinology and anatomy and physiology too, you'll learn about the adenohypophysis and the neurohypophysis. When there is inflammation or enlargement of the pituitary, you can imagine what's going to happen if you have a gland that's sitting right here and right here and here. There's your optic canals, and what travels to the eyes are going to be these optic nerves. So if this pituitary gland starts to enlarge like a tumor, you can see how it's going to interfere or block with the transmission of impulses from the eye to the brain or from the brain to the eye, because the optic nerves are going to be blocked, and that can lead to visual disturbances to the eyes. So there's a lesser wing, a greater wing of the sphenoid, and the sella turcica, and the smooth depression of the sella turcica is called the hypophyseal fossa. Okay, here's the greater wing, sorry, the lesser wing, my bad. Here's the greater wing of the sphenoid, and here's the sella turcica. If you put sella turcica here or you put hypophyseal fossa, they're both correct. I mean, that's what this area is really interchangeable for both. If the lesser wing is asked on an exam, don't put just lesser wing, it's lesser wing of the sphenoid, greater wing of sphenoid. You have to be specific for that. Here's what the sphenoid bone looks like when we extract it. That's the purple bone here in the skull. Again, it looks like the bird or the butterfly wings. And we have a lesser wing and we have a greater wing. These are important. These pterygoid plates are very, very important. There is a medial and a lateral pterygoid plate, a medial and a lateral pterygoid plate. And these pterygoid plates are the attachment site for the pterygoid muscles. And the pterygoid, let me write this here for you. There are muscles of mastication. Mastication means chewing. And I call them time muscles. These are the muscles that help you chew. The T is for temporalis muscle. The M is for masseter muscle. So we have masseter, which is one of the chewing muscles. We have the temporalis. The temporalis muscle. These are chewing muscles. And then we have an I and an E. And the I and the E stands for internal and external pterygoid muscles. Internal and external pterygoid muscle. Well, the internal is the medial, same thing as saying medial. And then the external is the same as saying lateral. So the external pterygoid attaches to the lateral pterygoid plate, and the internal pterygoid muscle attaches to the medial pterygoid plate. So medial and internal are kind of interchangeable. It's another way of saying it. And external and lateral are interchangeable. And these muscles go from the pterygoid plates to the mandible. So those muscles are going to kind of go on this diagonal, here to here. So when you chew, right, chewing just doesn't go up and down, but your jaw also deviates side to side. And it's those pterygoid muscles that are responsible for the lateral and medial deviation of the jaw based on the pterygoid plates and the pterygoid muscles. Okay. So this was your frontal sinus that we covered before, right here. And here's the sphenoidal sinus. Right here is your pituitary gland. Pituitary gland sits in the hypophyseal fossa. Here's the pterygoid process. And again, this line right here, and this line right here, this line here, this line here, right? So this is the medial, this is the medial, this is the lateral, and that ridge is the lateral pterygoid process. When we look at the ethmoid, bone, the ethmoid is going to have a few important sections. So let's look at the nasal region first. Now, you'll see that there's this vertical section here to here. That vertical section is the vomer. It's the beginning. It's that most inferior portion. But from midway up, from here to here, now it changes its name to the perpendicular plate. And the vomer and the perpendicular plate, these two are going to make up your nasal septum. You've heard people say, oh, I have a deviated septum. So this is the nasal septum, but it's really two parts. You have the vomer, and then part two here is the perpendicular plate. Now, right here is the cribiform plate, and you'll see, remember the cribiform plate has all these little dots, all these little perforated holes in it for the olfactory nerve to pass through for smell. The perpendicular plate is going to extend right through the cribiform plate, and the extension superficial to that is the crista galli. So it's like three structures. It's like one continuous vertical line, but it has three parts: a vomer, a perpendicular plate, and then the crista galli. The crista galli, again, is superior to the cribiform plate. In the nose, we have our middle nasal concha and an inferior nasal concha. The superior one is too high. We can't see it. It's being blocked by the bone. But here's the middle nasal concha, and here's the inferior nasal concha. These are the things that when you breathe in air, it moistens the air, it filters the air, and pulls out any debris, and it warms it, moistens it, and filters it. And it creates the meatuses, the inferior meatus, middle meatus, and then up here somewhere would be the superior meatus, which are the canals. So another view of it, this is actually really cool, because if you look here at the superior nasal concha, the middle nasal concha, and the inferior nasal concha, you'll see why they're also called turbinates, because from this view, it looks like a wind turbine. The way that the air is going to spin through this, it's going to centrifuge it. And then in between each, you have the inferior nasal meatus. Sorry about that. Here's the meatus, and then here's the middle concha. So you have an inferior nasal meatus, a middle nasal meatus, and a superior nasal meatus. And then you have a superior, middle, and inferior concha. Okay. If we look at the nose in the center, here's the vomer. Here's the perpendicular plate. Right here is the cribiform plate. And above that is the crista galli. Okay. Here's your frontal sinus from this view. Here's the maxillary sinus from this view. Here is the supraorbital fissure and the infraorbital fissure. We'll go through that in a second. So now here, right, here's the perpendicular plate, here's the crista galli, here's the perpendicular plate, cribiform plate. So now here's the cribiform plate in green, and this line is the crista galli. The cribiform plate, you can see, has all those perforated holes, and the perforated holes are for cranial nerve number 1. Cranial nerve number 1 is called the olfactory nerve. Olfactory is for the sense of smell. If you've ever drank something a little bit cold, like if you ever drank a frappuccino or ate ice cream or ices or something too cold, and you have pain between your eyes and you get that frozen brain syndrome, that's really from cranial nerve 1 being stimulated by the cold temperature, and it hurts like anything right between the eyes. Okay, so cranial nerve 1, it's the first cranial nerve that develops, which is why it's called cranial nerve 1. Olfactory, the crista galli is that extension of the perpendicular plate, and the perpendicular plate is an extension of the vomer. Okay. Again, on the model, here's the Cribiform Plate, and here's the Crista galli. You don't really see the perforated holes very much, but because this looks like it's a plastic model, but all those perforated holes would be here. And this is why it's really important. I mean, if you look, this is what we call the endangerment site, that nasal cavity, because if you have viruses or bacteria that enter the nasal cavity and it hits that olfactory nerve, it really is only in here is the brain, right? So how much space is there, and what's the delineating factor between the brain and the nose is this thin layer that of the Cribiform plate. Okay. Okay. Here is the vomer. Here is the perpendicular plate. And then in the green is the, this is actually should be the middle. This should be the middle, and this should be the inferior nasal concha. You can't see the superior. The superior would be up here. Okay. So middle, and then you could put inferior nasal concha. Okay. So this looks better. So here's the middle nasal concha. This one here is the inferior nasal concha, vomer, perpendicular plate, and then cross section, right? Somewhere in here is the Cribiform plate, and then the Crista galli would come up above that. Here is the Ethmoid Sinuses, right there. Here's your maxillary sinuses right here. Okay, we'll take a break here.